Good evening. I'm Dr. Devesh working as ENT and head and neck surgeon in Nishat Hospital, Lucknow. Today I'm going to talk about something about the nose. As you know, nose is the midline structure of the face surrounded by eyes and oral cavity. See, nose is very important in giving the beauty of the face, one, and the other most important thing is breathing is basically from the nose. You see, some basic point about the nose is nose definitely has got two openings. We call it nares, which opens posteriorly into the throat or the pharynx. With those two openings are called as the coining. These two apertures divide the nasal cavity by it is divided by a nasal septum, which is midline structure, which makes two cavities surrounded by two turbinates on the lateral of the nose. The problem of the nose is basically depending upon the age of the patient. Basically, you see, age is very important. Like if the child has got some problem, it is different from the adolescent, from the adult, from the elderly. So three basic symptoms or basic problem with the nose are bleeding from the nose, blockage of the nose, and sometimes tumor or something like that. So these three problems, basically if you divide according to the age of the person, then the commonest problem in children is that's bleeding from the nose. It is just because of the nose picking. Second, if it is elderly, it is the hypertension, yani increased blood pressure, which causes bleeding. If it is a person is in the age group of adolescent, then it is trauma or the tumor. The other point is, if the patient is in the age group of adult, then the commonest problem is about the infection and the tumor. Why I have decided? Because the problem of the nose is usually not life-threatening, but it's a regular nagging problem creating disturbance in the routine life of the patient. If the child is having problem of the nasal blockage, that means his growth, his mental acumen will also be affected. But the commonest problem in adult and in adolescent is your allergy. In my knowledge, allergy is a very common term, but not commonly found in the persons, because allergy is very specific thing. When you've got symptoms of nasal blockage, nasal discharge, nasal itching, eye irritation, eye discharge, or eye watering of the eyes, then the chances of allergies are more. It can be seasonal, it can be perennial, it can be annual, whatever it is. But treatment point of view, allergy as a whole is treated in the same way, whether it is in the older age group or in the younger age group or it is in the elderly age group. The other problem, if I divide like nasal blockage, if I elaborate, you see, if the child is having nasal blockage, the commonest cause or the usual cause, I will call it as a adenoidal hypertrophy. This adenoidal hypertrophy is something which should always be looked in a patient of younger child age group to see that, because it affects his hearing, his shape of the mouth, and we call it the adenoid facies. If the patient is adolescent age group and also presenting with the bleeding from the nose, then always think of a tumor. We call it as a angiofibroma, which is commonly in males, not common in females. The other problem in adult, what I call it as a trauma or a tumor. And the more simpler problem is deviated nasal septum, which is a midline structure, as I have told you, in the nasal cavities, which shows if it is deviated, it is also causing the nasal blockage. The other common problem in adult age group is commonly known as the sinusitis, because anatomically nose is surrounded by the air spaces, which are called as the sinuses. You see, this sinuses, when get inflamed, they produce copious amount of the mucus, and that mucus, if it is not drained properly, then it causes blockage and symptoms of headache, heaviness, and loss of taste and malaise and letharginess it can occur in any of the patients. The other problem with the nose, which I should always say to the patient, that nose is basically meant for breathing. So any problem of the nose is always associated with nasal blockage. In adult or in elderly group, if the person is having nasal blockage, then I will always say that most common cause is tumor. Sometimes it is benign, we call it as a nasal polyposis, and otherwise it is malignant, depending upon the situation and the place where this lesion is there. The management is according to that. The only preventive or precautionary step in the nose and its problem is never put anything in the nose, because it is not required. If you have got anything related to the nose, consult a ENT surgeon.